So, first question I have for you is I believe based on your LinkedIn, you've been with UMKC for 5 years. Is that correct?
Oh, almost. I think I'm at four right now.
Four
Yeah.
years? Okay. What is your title? What's your role right now?
Yeah. So my role is the senior manager of dental admissions. And so really what that entails is I handle recruitment admissions and the matriculation for our dental students and then our dental hygiene students. And so those are our two major programs at our School of Dentistry. We have a couple residency programs, but our office doesn't handle admissions for the residency program. So really, um, I'm overseeing recruitment, so kind of attracting attention to our programs, the admissions process, and so helping the students kind of work the admissions process. And when we selected students, I help them kind of matriculate into dental school. So what I always try to tell students is I work with students from the moment they express interest in our programs up until their first day of class.
That's awesome. And I know it's a year-long process because I see the admissions counselors and staff work year-round at the
Yeah.
school I attend. I mean, we got into school and I was like, I wonder what they do. And they're already prepping for the next year. Like
Yeah.
there's no break that you guys get.
Yeah, it is like kind of a cycle. I always feel bad because I get to know the students really well as I work through the process, right? But like by the time the next cycle starts, I'm kind of already kind of forgetting some of their names, things like that. And so when they're here, I'm like, I feel like I knew you so well. But you're kind of starting that next cycle of recruiting the next group of students. So.
And what specifically drew you to dental admissions? Was it just an opportunity that arose, or was there anything in particular?
Kind of a combination. I've always been in higher ed my entire professional career. I've always kind of been in admissions, advising, things like that, those kind of roles. And so I did large scale, or I would say large school admissions. So like I used to work for Missouri State University in Springfield, Missouri, which is a larger institution. And I really didn't really enjoy you're not really getting to know the students well through the process. There's so many of them, so they really don't have a chance to actually get to know them really well. But prior to that role, I used to work for a nursing health science college where we had a very small enrollment. And we would bring in, I think like 30 nursing students, like maybe five or six, I would say radio technology students. And so I really liked getting to know the applicants, getting to know them through the admissions process, helping them. I feel like I was really able to help them through the process. And so when I was looking for a new job in higher ed, I wanted to stay in admissions, but I also wanted to go to a more smaller, I would say smaller program. And so the School of Dentistry popped up, and it kind of just worked. I met my supervisor, who's the assistant dean for students, and I just really liked his energy, and it kind of was a no-brainer when they offered me the position. So.
That's awesome. And class size of 109, are those stats accurate from Google
Yeah.
around
Class
there?
size of DDS size of 109, and then our dental hygiene is 30.
Okay,
Yeah.
okay. And since you've been in this role 5 years, specifically at UMKC, are there any trends that you've seen, like gap years, stronger academics, in these 4 or 5 years?
Yeah, I would say there's a couple trends. A few I'll mention. One, the gap year thing is definitely one where I would even say my first year here, like gap years were probably still kind of looked at as taboo, as almost like you're doing something wrong, maybe a little hesitant, maybe unsure about the profession. Whereas now it's like I think in my personal kind of observation, I feel like a lot of faculty members like the gap year. It shows that like they've gained some life experiences that might help them better working with patients. And so it is kind of a trend where when I first started, like maybe it's still taboo to now where it's like if a student has a gap year, it's kind of seen as a plus. Um, that's like a caveat of like if you do it right? I think there's a
Yeah,
wrong.
if you're doing something in that one year.
Yeah, there are definitely wrong and right gap years. But if you do a gap year and you're like staying engaged in the profession, then I think it only helps you. I think it kind of shows that like you're gaining life experiences, you're kind of developing more maturity, things like that. So that's one trend I've noticed. The academic one is one that I think we continue to struggle with, and we have conversations here at the school at UMKC School of Dentistry all the time about what are like good academics and strong academics are important, right? But like to what degree, right? At what point is like someone just having exceptional academics, but maybe like poor, I would say, communication skills or leadership skills or things like that. What can like that allow another student to get in? I think academics are increasing so fast. I mean, even if I look at our average GPA from, when I first started to now, like it's gone up significantly. And then someone would say like 2 points or 0.2 isn't significant, but like it really is, right?
Yeah.
Like if your average class is incoming GPA is a 3.6, but then in 4 years' time it's a 3.8, that's huge, right? Like that's and that doesn't even take into account the DAT, which we're also seeing those jumps in the DAT. And so that trend is definitely there. Like schools are wanting really academically strong students. My big kind of hesitation is that like if we focus so much on academics, are we missing kind of these other qualities that make good dentists? Because like at the end of the day, I think I heard I forgot I was at a conference and someone said this that's really stuck with me that like dental school, if you look at like a typical dental school curriculum, right? Like how much of it is like actually truly classwork, lecture based coursework, right? A big portion of your dental school curriculum is going to be lab work in the lab, developing your skills, in the clinic, working with patients. Like it's not even 50-50, right? It probably more leans to like clinical lab work than it does truly academic coursework. And so, but it seems like we're weighting this academic piece so heavily, right? And it's like, are we really capturing the ideal student to make the ideal dentist, right? And I think that's something that every dental school probably across the nation is probably grappling with. I think presenting it to alumni, presenting it to community members that like, look how academically strong our class is great. But I think, are we truly producing the best dentist? And then the third thing, a trend that I've kind of noticed is like I would say male female ratio. I remember my first year, it was like our class specifically was like 52 percent male, 48% female. The next year was kind of like it kind of shifted a little bit to where it was like it's like 55 female, 45 male, and then like I've seen that like go up to almost like we were pushing close to like 65 female, 65% female, to where even in this incoming class that we just accepted, we're kind of getting back closer to 50%. So I don't know. That's a trend that I noticed for a little while, but I don't know if it's shifting back. I don't know if it's just kind of outlier years to where we have more female applicants than male applicants. But it's something I'm definitely keeping an eye on. I want to make sure that our process is equitable, and that everyone has a fair shot and that we're not leaning further to one side or the other. So.
Right. A couple points on what you said. The first thing is about the gap years. I've noticed specifically in my class, because I have the most exposure to my own experience, I would say like 80% of my class has taken a gap year. Like I was thinking I was an outlier by taking a year off in between undergrad and dental school, but it's common. And another thing is changes in GPA and DAT. When I was a freshman in college, so 2020, I would say for my in-state schools, a 19 DAT is considered like a good score. Like if you got a 19, you're a shoe-in at ECU. And if you look at the average admitted applicant for ECU, and I'm sure it's the same for you guys, it's low, it's like a 21, and that's an old scoring system,
Yeah.
but it's a big change on
Yeah.
what the expectations are. But as the resources get better, DAT Bootcamp, DAT Booster, the scores are just going to keep getting better. But a follow-up question, you talked a little bit about UMKC's process, but how is it unique compared to other dental schools in your experience?
Mhm. How's our process unique? That's interesting. Um, I don't, that's a good question. I don't know if I would truly say that our process is truly unique.
Or I guess
Right.
your dental school as a whole, because everybody does the ad SAS and you have interviews.
Yeah.
So
I would say from a school perspective, where I think makes our program unique is like this truly like I would say like our faculty, our administration does a really good job of kind of trying to really build in early clinic experiences for our students. Since I've been here, I feel like every year we've taken another step to earlier clinical experiences for our students. And it's tough to say if it's truly unique because maybe other schools are doing that, but it seems very deliberate at our school that we're saying like we understand that students get into dentistry not to sit in biochemistry class, not to sit in histology or morphology. They're doing this because they want to interact with patients. And I think our faculty and our administration have done really, I would say, interesting things to like really say, okay, we know it's something you want. We can't like throw you in immediately first year, but like what can we do reasonably to make it less didactic and more like practical experiences? And so I know that we now have the dentures course that happens kind of towards the end of your first year with us. So now you're working with the patients on providing a set of dentures. And so I think that's kind of awesome because like one thing I hear from students on the outside or when I get questions is like, when's my first, you know, clinical experience? When's my first patient experience? And it's nice to say that like in your first year, you're going to be working with patients like as a primary provider. So I think that's pretty unique as an institution. Again, other schools might be doing this, but in my experience, like just from the time I started to now, it feels like we've definitely taken large steps to give students more patient experiences. I would say, because I keep going back to the process, I would say one thing I like about UMKC's admissions process is that we're constantly adapting. Just because something worked 2 years ago does not mean that it might still work now. Um, I would say this is probably chalked up to like our assistant dean for students, my boss, who's he's really focused on like analyzing and assessing. Okay, we just finished this application cycle, like in this admissions process, like what worked, what didn't work, what can we do better? Are we really gaining enough information from this process? As an example, one thing that happened recently is that we noticed that we were asking about critical thinking skills, right? We were telling students that we're assessing your critical thinking skills through our admissions process. When we like truly looked at our admissions process, like we really weren't. There wasn't there wasn't anything I could point to that says like I really know if that student knows how to critically think. So what we did is we kind of adapted our interview process to really pull out and really focus on students critically thinking through questions, through scenarios to provide us responses. And I kind of liked how we're looking at what we're telling students we're going to do through the admissions process and really asking the question, are we getting our students able to kind of showcase that through our process? So I appreciate that. I think that's a highlight.
Yeah, I think self-reflection and not just moving to the next cycle is important because you're actually adjusting what you guys want from students that apply. So kind of broader questions. This first one, this one's probably in the mind of every pre-dental student and it's what makes a strong applicant. So I've been a firm believer in saying that if you have relatively lower statistics, but you make up with that with strong extracurriculars, strong personal statement, that you're more favorable than someone that just shows statistics. Obviously, there's nuance to that. You can't have a 1.5 GPA and expect to just get in based off your extracurriculars. But is there any merit to that conversation of a holistic application? When a dental school says they're holistic, do they actually mean that?
Yeah, so I want to talk about two things real quick. I always say like I don't even really say holistic anymore. I think that's like not fair. I say we're a competitive holistic program. The competitive means that like if you hit the minimum qualifications that we're asking for, then we can start looking at it holistically, right? I think the misconception I see sometimes is like we'll say holistic, and the student thinks that like any academics with strong experiences gets me in. It's like, well, no, no,
Yeah.
like, competitive holistic. Like if you meet the minimum requirements, then other things can take over. I would say to kind of your point, the one thing that I would say makes, in my mind, the most powerful applicant, the ones I think about all the time, are the ones who are like a little vulnerable in the process. One thing I think is really, I I'm gonna try to say like positive here. One thing I think gets under my skin a little bit with applicants is this attempt to paint the perfect application or like paint themselves as like the perfect student, right? When realistically, I think you're not doing yourself any favors. Like getting into dental school is really hard. It's a hard journey. It is so challenging. You're making sacrifices that a lot of times your peers in other majors aren't making. And like I think you need to talk about like or be vulnerable about the fact that this was challenging to get to where I was to even to present a 3.69 math and science GPA with the 19 DAT, that required some sacrifice. And I think you should talk about those sacrifices as opposed to just making it sound like I did it, like I look how great of a student I am. It's like, no, like there were nights when my friends were going out to different events and I couldn't go with them because I had to study for a biochem exam or I had to study for the DAT. Like I think faculty want to see that, like, in a way you're dedicated and focused and you're willing to sacrifice a little bit to be successful, because you're going to have to probably do that in dental school sometimes, right? You're going to probably have to miss some things that you want to make. You're going to probably have to stay up late, do extra work to get there. And I don't think students do themselves enough favor by not being a little bit more vulnerable in the process. But I think I definitely agree with you. I think I always try to say, like, this is gonna again sound really weird, but I feel like not all GPAs are created equally. It sounds so. It
You can
sounds like,
definitely fluff up your GPA
yeah,
with easy science classes.
yeah. Like I always present the example of like if we have an applicant who has like a 4.0 GPA, and then I look at their like transcript and the most credit hours they took per semester was 12 credit hours per semester. They're not involved in any extracurriculars. They're not working. They're not like doing anything extra. I'm like, yeah, that 4.0 is great, but it's that's not that impressive versus like someone who's like at a 3.5 who is taking 15 credit hours a semester, working part-time, involved in multiple organizations. Like that 3.5 stands out so much more than that 4.0 with 12 credit hours. Like like, so I think like sometimes I always say to students, like, you should sometimes be able to risk your GPA for better experiences. Like that doesn't mean you should go from like a 4.0 to like a 3.1. But like if you go from like a 3.8 to a 3.6, but you've built up some really, really strong experiences, like it's probably gonna be more impactful on your application.
Right, right. And what you were saying when you initially answered the question was about students being genuine when they're doing the application, and especially in interviews. And I had a couple of interviews, and I could tell when other students weren't being genuine, fighting to open the door for the rest of the cohort or potential cohort to go through a door and just funny things like that. So I've always wondered, can you guys tell when an applicant is not genuine, when they have this facade? Because I can when I'm in the room with them, but I don't know if it comes across as very professional in dental admissions eyes.
Yeah, like we were actually talking about this about a month ago. We were talking with the faculty about the admissions process, and I would say like it's pretty easy to tell when someone's not genuine, especially like now that we've gone to scenario-based interview questions. Like it's pretty like you sound kind of robotic on like with a scenario if it's not genuine, right? Ideally, like this is like what would you do? Like, what would you do if you presented the situation? It should be more organic, right? It should flow kind of like it should be choppy, right? It should be like you should think about it. A lot of times students are just like, "Thank you for that scenario. I would do X, Y," and it's like that. Like I don't know if you would actually do that. Like that's it sounds like that you're trying to tell me what we want us to hear, and we kind of just want like a genuine answer. I think one thing that like I'm big on is like if you say something in your interview, I'm also looking for evidence in your application. Like I always tell students one thing that I struggle with is like a lot of times students in their personal statement will say like, my top quality is being caring and helping others, right? And if you say that, my next step is I'm looking for any justification in your application that that's the case, right? Does a letter of recommendation talk about how you're caring and like you're really helpful? Like, do you have a lot of community service hours? Like, I'm looking for evidence to support your claims. So, like, I don't even like your claims are your claims, but I need evidence to kind of verify that that's who you are or not. And so, if you say, I think. One application I read a while ago, the student talked about how um, I think my strongest quality is professionalism. And I remember reading a letter of recommendation that said the dentist said, I think this student will be a great dentist online. They need to work on their professionalism. And it's maybe like
A little
oh
contradictory, yeah.
it's like, oh, that doesn't line up at all. And it's like that's what you want to avoid. So it is easy to tell. And I think being genuine as possible is probably the best way to go. I just think it is. Like you put in a lot of hard work. You've got there. If they're inviting you for an interview, there's probably something they saw in your application that they liked. So like you don't need to like present a facade at that point. Just kind of be yourself.
Do you see a lot of interviewees that over prepare for their interviews,
Yes.
like rehearsed answers?
Yes. Yes. I get it. I even tell students to practice. I do, but like you should never rehearse. Like you should never rehearse because like I, if if you rehearse an answer and like a faculty wants to kind of question you further on it, like that throws everything off, right? Like and now you're kind of now you're spiraling a little bit because like this was I wasn't expecting this or like um I always ask like one student asked about that and I said like what are you rehearsing though? Like if, even if you got the answers in advance, like it would sound weird if you were prepared, right?
Hmm.
It would sound so unauthentic. I think you should practice. I think there's a difference between practicing and being prepared versus like having a scripted answer. Um, Even like the one I don't like a lot is like every dental school is going to ask you why dentistry. That response should be authentic and genuine, not rehearsed, right?
Hmm.
If it's rehearsed, it doesn't like you lose the personal touch, right? You lose like people aren't drawn into your story at that point. You know every dental school is going to ask you that question, but like I wouldn't say you need to rehearse your answer. I would need you probably need to just kind of formulate it and be prepared to talk about it, but like not rehearse it.
Right. And speaking of red flags being inauthentic, maybe letters of recommendation that don't reflect yourself, what are some other common red flags that you see in interviewees or on their AdSAS?
So okay, interviewees or ads. Okay, so for AdSense, I think the big one is um, you filled out an AdSense application, you might be aware what I'm talking about. When you list an experience down, it gives you an opportunity to kind of talk about that experience. One
Hmm.
of the biggest red flags is if you when a student like shadows at a general dentist office and they say what they saw at the general dentist office, that is
Not what
like
they took from it. Yeah.
yeah, like because I always try to tell students you got to remember like who's reading your application. Like if a general dentist faculty member is reading your application and it says you shadowed at Smith Dental Practice and this is what you saw, they know what you saw there. Like they are a general dentist. They understand what happens there. You need to talk about like what you gained from those experiences, how you reflected on that experiences. I think that is a huge red flag that I think hurts a lot of applicants by just kind of I saw a couple fillings, I saw a couple crown preps, saw a few cleanings. It's like we know what happens there. Like if you shadow an endodontist, we know what happens at an endodontist office. Like what did you take from that experience? I think that's a huge red flag on applications. Um, in interviewees, I just the over preparedness is definitely one. Not elaborating or providing depth, I think is another one. Um, I think if you're gonna practice anything when it comes to interviewing training, is like having a fleshed out answer that's not too long, right? There's always a sweet spot between like you're talking too much and you're not talking enough. And I think that's what you should practice, right? It's like kind of like providing clarification. I think good interview responses usually connect back to your actual experiences. So if we ask you an interview question, use your past experiences to reflect on that question and to answer that question. That provides evidence, clarity, and depth at the same time.
Right. Right. That makes sense. A couple more general questions. What makes you excited when you're reading an application? All pre-dents try to look unique. We all try to get our 100 shadowing hours or more, try to get involved in pre-dental clubs, get good grades, have some dental experience. It's hard for us to know what actually makes us unique. So when you see an application, and I don't want you to get bombarded with the same experience on the next cycle when someone hears this, but what makes you excited when you see or read an application?
I'm gonna be I'll probably be super transparent here. This is personal pet peeve of mine. Because I read a ton of personal statements. Um and I'm gonna talk about the negative first, and then I'll talk about like what you can do, what makes you excited. When a student, when I pick up a personal statement, I sit down and read it, and they start off with like, I knew I wanted to be a dentist from the age of 6. And I'm always, or like, a young age, and I'm always just like, oh no. I'm like, oh no. I I I don't know if students think that's a unique story. from my experience reading personal statements, it's not a unique story. I also think it's like not helpful and not true. I think you may have got your first exposure to dentistry at a young age, and it was a positive experience, and that's good. But like I always try to tell students, that wasn't the moment you decided on dentistry. Like no one like truly kind of picks their career at like 6 or 5 years old, right? Like if that was the case, we would have a ton of like firefighters and a ton of policemen. Like, that's not how it works. Like there
Right.
was probably a moment in your journey where you like narrowed it down to healthcare. And then you also from healthcare narrowed it down to dentistry. Like that's the moment. Like what was that like aha moment? Like I want this over any other profession out there. It wasn't like when you were 6 in a dental chair and you had a good experience. Like and talking
Going
about that,
going to an orthodontist and getting braces and making a good
yeah.
experience.
And it's like it wasn't there. Like I know in your mind you think that's a unique story, but like that's probably like 70% of the personal statements, right? Like who had that positive or negative experience as a kid and that shaped them to being a dentist. Like that was your first exposure, which is really important. But there's probably a more aha moment later in life. It probably happened in high school or early college. Especially like I know in early college, like you are getting exposure to other professions, right? So maybe you go into high school and you're like, I want to be a dentist, but like maybe pre-med, maybe pre-physical therapy. But then something happens that says like, no, 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 dentistry is the route, right? And like that's the moment we want to hear about. That's the unique moment, right? Because that moment, unlike the you being a kid, is unique to you, right? That moment is truly unique. Um, I, I wish students would tell us that story more than like I got exposure to dentistry. It was positive. I want to now share that positive experience with other people. Like I mean, like I don't want to diminish your experience. I just think that's a very common experience that like lacks any personal touch. And so I really wish students would use their personal statement to truly find the unique nature of why they're doing this. And to me, that just means I don't think you spend enough time thinking about your why enough. Um, and so that's one thing I would say with helping students stand out a little bit. I would also say the best students are so self-aware. They're so proactive in their applications. Like they know the weak points of their application and they address it before we even get to it, right? Like they provide the context for whatever reason. And I think those students do really well in the process. Because that means you have good reflection. You know, like these are the areas I'm gonna do well and these are the areas I need to work on. I think faculty love seeing that. Like you have good self-reflection. Every faculty member wants you to be able to self-reflect and be aware. So that's another way to help stand out is like truly trying to understand who you are and how you connect to your profession, but how you're going to do in dental school. So,
Okay, these are more rapid fire questions.
okay.
Advice to a re-applicant.
Ooh, advice for reapplicant. Stay stay connected with the schools you're interested in. I think yeah, stay connected to the schools. I'm gonna leave it like that. Say like I want to hear from you. If you're a reapplicant and you're really interested in my school, I want to hear from you. That doesn't mean email me once a week, but that might mean email me here in February. Let's try to schedule a meeting and then email me again in April. Let me know how things are going. We want to hear from you. That shows your interest. That shows that you're still engaged. What I don't like is like I hear from you in February when you got denied, and I see your application in like July, and it's like, man, I haven't heard from you since then. Like, how are things going? So like, if there's a school or schools that you're interested in, like, express yourself. Show them who you are. That like, hey, I'm a reapplicant. I'm excited. Are there ways I can get better? Ask those questions. I think.
One thing dental applicants stress over that actually doesn't matter.
Ooh,
Research or I don't know, freshman GPA. I don't know.
yeah. Research is up there for sure. Like especially like if you don't like, especially if you're just doing it to do it. like it's not that huge of a deal. Like if you're really passionate about research though, do it. Like that is a good way to help you stand out. But like just to take on a research experience to do it is
I
like,
fell into that trap, yeah.
yeah, it's like I don't know. Um, things that don't really matter. Okay, wait. It's like there's something. Oh, you know what? I'm gonna speak for me. Like I think working in a dental office probably matters less than students think matters. I think it's good. I think it's a good experience. I don't think it's like I work in a dental office and I'm definitely getting in, right? I think shadowing is really important. Shadowing a lot of different uh clinics, I think is equally important, right? You don't want to have all your experiences like in one or two places. You want to kind of spread them out, show that you've kind of seen different aspects of the field of dentistry. I don't think you have to work in a dental office to get into dental school. Like I think that's one of the things if you do, that's great. But don't stress too much out about that.
Yeah, I've had a lot of pre-dents hit me up about, how do I get into dental assisting? And that's like a great experience to show, but it's not an end all be all
Yeah.
at all. Biggest myth about dental admissions.
Myth. Whoa. What?
I
Wait.
get
Tell me some myths first. I don't. What are some myths about dental admissions? I can tell you if they're real or not.
a myth could be the dental the people that interview you make up their mind the minute you walk out of the room. Like they know if you're in or not.
Oh, okay. That's a myth for
That's a
sure.
myth. Okay.
As someone who gets all the evaluations back from our interviewers, we interviewers struggle. Um, they struggle like for like hours, days making evaluations, right? I think one thing to share on that is like your interviewer is going to take time to like really because they understand how important the interview process is, the admissions process. They want to make a good evaluation of your candidacy. No one's basically saying like, oh, I heard everything I need to hear. This is their score, pass it on. They usually take some time, they think about it. A lot of them ask questions and like, hey, like this is how they respond to this question. Like this is kind of how I'm leading. Does that seem right? They want to make sure they're doing it right. And I would say for the most part here, and I'm going to speak for UMKC specifically. No interviewer has made their decision on you as an applicant from the first question. Um, One thing that we teach our interviewers is that like the vast majority are going to come in nervous. We want to try to loosen you up, get you more relaxed, and then we kind of start feeding you kind of the harder questions towards the back end of the interview. We understand like the pressure that's on you at the beginning, so we want you to be able to like gather yourself before we get to the kind of harder questions. So like even if you start off rough, that does not mean it's over at all. So
Okay, another myth. If I know someone at the dental school, that matters in whether I get in or not. Whether that's another student, maybe my dentist that I shadowed went to this school. Does that matter?
not really. Um, yeah, not really. Not no. I okay. Here is a myth that I'm going to say is true, or I don't even know how you would, and it kind of relates to this. Every interaction that a student has with a dental school, regardless of what that dental school says, is an evaluation. I can't stress that enough. Like I think sometimes students email me very casually, and even in that, I'm like, if you're a prospective student, that is like an evaluation, right? So like, I'm not saying you need to be like 100% perfect, but like, don't ever get too relaxed or too comfortable to where like that could be a complete setup to where like they're trying to catch you off guard a little bit. Like stay professional, stay cordial, and that kind of even applies with even like your connection with other people, right? I like and for our a perfect example is like for us, right? Students can shadow our dental students in the clinic. Even those interactions with our dental students, they weigh. Like if the dental student says like the student was really unprofessional, like that is huge, right? That's not good. So anytime you're interacting with the dental school, you have to treat it as like this could be an evaluation point. Again, that doesn't mean you need to be rigid and like strict, but you do need to like kind of take it seriously and be professional. So like I whatever, regardless of what they say, they can say it doesn't matter. Like I do not believe them. Like it is an evaluation period for them.
Yeah, I was told the minute, especially on interview day, the minute you step out of your car, from the minute you get back in
Yeah,
your car, you have to anybody that you interact with has to be in a positive light because that's what dental admissions want. They don't want a fake person that comes in there and is a completely different person when they start in their cohort.
exactly. That's I I've just seen that kind of hurt students at different points when they're like too casual to the wrong person. It's like, oh, that's not a good idea.
Yeah. I think I've exacerbated all my questions.
Okay.
So thank you so much again.
No, no, thank you for having me. This is great.
Yeah, I mean, there's not many experiences where I get to hear the mind of someone that on the other side, you know.
Yeah, yeah,
We're all like dental students and pre-dents all wonder the same things about, oh, I wonder what they thought of this answer or this
yeah,
question. So, yeah. Oh, one more thing
yeah.
that I'm thinking of. So there's all these new dental schools popping up.
Mm.
I believe in 2000 there was 55 dental schools. 2020 there was 65 dental schools, and in the 6 years since 2020 there have been 12 new dental schools that pop up, specifically private dental schools.
Mhm.
Thoughts, opinions?
It's my opinions. I'm always going to be supportive of the student. Um, it's tough because I want I want every student who's interested in dentistry and passionate about giving back to the community in dentistry. I want them to get into dental school by any means. So even if it's a private school, I really want you to go there if that's your pathway to dentistry. I get really nervous about the private schools and the costs, especially with like how financial aid is kind of shaping out right now. I still want you to be able to like be successful in your career, right? And I think some of the ballooning costs are a little bit much. So it's kind of hard. It's kind of even hard to advocate a lot of times for other programs when you see how much they're charging for tuition. It really is hard. Um, my biggest fear, and this is something I've just kind of thought is like when I talk to our students, we go through a 4 year program, and a lot of those students have really good experiences in our clinic, but a lot of them still want more experiences, right? They go on to GPRs and things like that. Um, so it really worries me when I see like shortened dental programs, like 3 year tracks, because like one thing our associate dean for clinic affairs says is like no one ever leaves dental school with too much experience,
Right.
right? And so it's like if you're shortening it a year, but like the students still could always get more experience. It's like what like is that always the best fit for them? So I just worry about like in an attempt to capture a market, are we not worrying about a student's overall financial success and then also like professional success? I think all I tell students is like, I want you in dental school, but I also want you making good decisions. And so I think you got to look at all those factors. I think if there's private schools out there that are 4 years that are reasonably priced or you get scholarships for, I think, yeah, that's a great opportunity for it. But like, I also don't think you should be going into a crazy amount of debts, um, like for a shortened program. I just get a little bit nervous about that.
Right.
Um, but yeah, I'm always going to advocate you as a student getting into dental school. So.